across Sussex there's around 28,000 people who live with a dementia. We know that the number of people who have a diagnosis of dementia is likely to increase. And it's really important that within the Trust we're able to respond to the needs of those patients and the family carers who are supporting them. It's been really exciting this last 6 months to be part of a feasibility study based in one of our community hospitals, which has been looking at the impact of music-based interventions for our patients with dementia and memory loss. We have musicians who attend the ward on a weekly basis, and there is an emerging evidence base to suggest that this is a very powerful way to work with people with dementia. In diseases such as Alzheimer's, the neurons that fire in response to musical stimulation are some of the last to be affected. So what happens is somebody may still be able to draw on lyrics of a favourite song because that part of the brain is still accessible. So what you see is an ability to communicate where perhaps previously we thought that wasn't possible. If a person with dementia has been able to share some of how they're feeling, that can help them feel more settled, feel less anxious, and also it does encourage more natural conversation between patients and staff, which means people's care needs can be better responded to. We're very pleased that this feasibility study has gone on to the National Institute of Health Research portfolio. That was very exciting for us. And we've partnered with Wishing Well, which is the programme of musicians in healthcare delivered by the Rhythmics charity. And we've worked very closely with our Trust's Research and Development Department. The results so far have been really promising. We have seen increased levels of well-being. We know that long hospital stays are expensive. We know that one-to-one care, because somebody's agitated, comes at a huge cost. So we really do need to explore these non-medical interventions to fully understand their place in dementia care and bring them into the everyday in the NHS and care settings.